Hi, I'm Patricia Ercolino, the producer of Sojourners Along the Way, and I'm very excited about our program today because 4 healthcare providers and professionals have taken time out of their very busy schedules to come and present this edition of Sojourners with information that I think all of southeastern Ohio will benefit from. I'm going to ask each person to introduce themselves, and some of them have a long string of letters after their names, and I want them to tell you what they stand for. Also, I'm going to ask everybody if while we're going through this interview, if they think of a question they would like to ask each other, that they will do that, and if they want to add any information to what is being spoken, that they can do that also. So, you are the first person to introduce yourself, please.
My name is Miranda Kreidler, and I am the Adult Education Coordinator at Live Healthy Appalachia.
My name is Karen Bailey, and I am a dietitian and diabetes educator at UMA Diabetes Endocrine Care here in Athens.
Hi, I'm Barb Nakanishi. I'm a registered dietitian and certified diabetes educator. I work at Ohio Health, Oblenis Hospital in Athens, and I also work at Hocking Valley Community Hospital in Logan, Ohio.
And I'm Ruth Dudding. I am a health educator at the Athens City County Health Department. I'm the Creating Healthy Communities Coordinator there.
The information that I was given is from 2012, and I'm very happy that we have some people here that have information from 2014. So, the question that I'm going to start with will be, according to the 2012 Ohio Southern Region Health Needs Assessment, the top 5 needs of this area are 1. Ongoing diabetes education, management and treatment. 2. Need for obesity prevention. 3. Need for substantial prevention and risk reduction for diabetes, heart disease, stroke, cancer, and chronic respiratory conditions. 4. Need for access to services and referrals for behavioral health, mental health, substance abuse. And 5, need for workplace health and wellness programs. All right, let's start off with the biggie that I know is very prevalent in this area, and we have a lot to learn about. So the first one starts out with diabetes. What is the prevalence of diabetes in Athens County? Who would like to field that question first?
I think it's about 9%. At least according to a 2008 study that was done.
Nationally, there's 29 million people with diabetes in the United States, and over 80 million with prediabetes. So it's very prevalent, not just in Southeast Ohio, but everywhere here in this country.
How can they call it prediabetes? If what conditions are there that would be different from saying this is a person who has to fight against diabetes?
Prediabetes is diagnosed as with a fasting glucose of lower than a diagnosis for diabetes, but higher than normal.
Thank you. Anybody else want to talk about the ongoing diabetes education, management, and treatment?
Well, first, can we talk about prediabetes?
Oh, sure.
And our community has some wonderful programs that can help people with prediabetes, and I'm going to let Karen take it from here because she has one program, and then Miranda, if anything you want to say about your programs fits in with that in preventing diabetes, go ahead.
We started in 2013 with the Diabetes Prevention Program, and that stems from a study that was done back in the 90s and early 2000s nationally in multiple centers around the United States that showed that lifestyle intervention works better than metformin at reducing risk for diabetes. And the Centers for Disease Control was so excited about that data that they have really encouraged health centers across the country to implement the program. So in January 2013, we started our first class, and we have classes, two classes per year. So the Diabetes Prevention Program classes are year-long lifestyle intervention program classes. And this is just a flyer that we usually market with. It starts in January on the 12th, this next class, and it'll be weekly for 16 weeks and then monthly for the rest of the year. In the classes, people learn about lifestyle interventions, healthy eating, increasing physical activity, and the goal is for them to lose at least 7% of their body weight by the end of the year and maintain it, and increase their physical activity to at least 150 minutes per week. So in the classes, we really encourage and discuss that, and that's the ultimate goal for participants. And our last group lost an average of 29 pounds
Wow.
each by the end of the year. So it's been really effective. It's a lot of fun, and we'll keep it up at least twice a year. We do have some scholarship money for participants that are interested in being in it, and there are also 7 employers that cover the cost of the DPP program in the area. So if anyone's interested, they should give me a call, and my number is at the bottom of the flyer.
Would you please give that to us?
It is 740-566-4877.
I can just add a little bit about the Complete Health Improvement Program, which is sort of a complementary lifestyle evaluation, education, enhancement program that focuses a lot on making healthier choices in the kitchen, eating healthier food, and really understanding what the health implications of what you eat and your activity level really are. And so the CHIP program is another community-based program here in Athens. We offer a 9-week program, and we have a class starting in February. And that's a little bit more general. It doesn't touch on just diabetes, but I know we'll be speaking about obesity and other chronic disease that affect Athens County. So I would really encourage folks to look at both of these programs. We've got some incredible options here in Athens. And if you want more information about the Complete Health Improvement Program, and especially our class that's beginning in February, you can contact us at Live Healthy Appalachia, and our number is 740-856-6100.
Now, you said you have a program starting in February.
We do.
Do you also have scholarships? And if so, how does a person apply for that, and what would it cover?
Absolutely. For those who qualify, it's income-based, and we have scholarships to cover the full cost of the program. And we also have partial scholarships for those who can't pay the full cost of the program. We track biometrics as part of the program, so you'll get lab work done to really understand sort of where you start and how making changes in your diet and exercise habits can actually affect those biometric markers that are indicators for chronic disease and like diabetes. Mm-hmm. They can, for scholarships, they can just contact the office, and we'll set up a time to speak about that.
Okay. You want to give that number again?
740-856-6100. And you can also find more information on our programs at www.livehealthyappalachia.org.
How do you spell Appalachia?
Appalachia.
Thank you.
Is that my quiz for the day?
No, I'll come up with some more questions. Okay, Ruth, are you involved in any of the diabetes education, management, or treatment?
In public health, which is the agency that I represent, our focus is really about very individualized but population-based choices. So we really work on policies, systems, and environments where people make the choices that Miranda and Karen talked about in terms of diet and activity. So the health department looks at a community instead of a person and says, where here in this community, this school, this work site, can there be opportunities for physical activity or opportunities for healthy eating? Mm-hmm. So that's really our approach, is this prevention. So before people have pre-diabetes, pre-diabetes, mm-hmm, mm-hmm. And hopefully, linking these resources with the rest of the community as well. So building that infrastructure so that people automatically make the healthy choice, or the healthy choice is the easy choice.
Mm-hmm. I have a question. Are any of you vegetarians?
I'm a vegetarian.
You are a vegetarian?
Mm-hmm.
Okay.
I call myself semi-vegetarian. I try to do 2 out of 3 meals a day.
Mm-hmm. Okay. Plant-based, strong plant-based.
Right, I would agree with that. Just trying to emphasize plant-based choices, maybe not strictly vegetarian or vegan, but we really encourage people to think about how to eat more vegetables, how to eat more fruits, how to eat more whole grains. So that's sort of a different spin on the same approach.
Yeah, but what about you personally?
Personally, I am not a vegetarian.
You're not a vegetarian? Not leaning that way?
Certainly leaning that way, and certainly I eat a very heavily plant-based diet, but I wouldn't call myself a strict, I don't want to lie to anyone and call myself a strict vegetarian.
I think that that's a good point that you make, because I think a lot of people, and I see a lot of patients that really grapple with it. They've gone through the CHIP program and they really admire and embrace the principles of it, but they don't feel like they can completely 100% be vegetarian. And I think the program, and rightly so, encourages people to do what they can. So there's a spectrum of meat eaters, and and then all the way on the other end are vegans. Where can you find yourself on that spectrum? And as far as you can move in that direction, it's better.
I have a visual that might, this is a brochure called Nutrition Guidelines for Better Health, and I think this speaks really closely to what Karen is talking about, a spectrum. And it talks about foods that you can eat freely, foods like whole grains, fruits, vegetables, unprocessed foods that we would encourage you to eat as much of that as you want, and nutrient-filled foods. Foods that you might want to think about eating less frequently, maybe want to avoid eating on a daily basis. And we talk about that as being 20% of the choices that you might make. And then another category is sort of the stop and avoid foods that we really think that people should think about strongly, heavily reducing from your diet. But again, none of that is hard and fast, and depending on what your health issues are, you might make a different choice. But there's always, along that spectrum, improvements to be made in how you make those choices for your health.
And I think those generalized terms like vegetarian and vegan are very misleading, because I know that you can call yourself a vegetarian or a vegan and still make some really unhealthy choices. So it really is more about choosing those whole foods, unprocessed foods, that no matter where you are on that spectrum, making the best choices.
Now, you said you are a vegetarian. In fact, if I recall correctly, you're the only vegetarian in this group. I personally would also say I am leaning towards becoming a vegetarian. And for me, I did not want to call myself a vegetarian because I didn't want to feel deprived. But I stopped eating pork years and years ago, and I found how beef was affecting my body, and it sat. So I've eliminated a lot of beef. I eat it extremely rarely. And recently I've had the opportunity to learn more, and so I've made the decision that I personally want to head towards being a vegetarian, and even perhaps towards vegan. But I want to know, how did you come to that place? How did you become a vegetarian?
Well, I actually went to a training seminar to become a CHIP facilitator. And I was actually already a vegetarian. I am a vegan, and but I still had high cholesterol. So I learned a lot from the program personally, and really applying those whole foods principles made a difference. And I think most people who participate in a lifestyle program, because our culture is very much not promoting the very best choices. We offer food at a gas station. You can get food when you go just about anywhere, and it's not the greatest food. So learning about how you can directly affect your cholesterol, your diabetes numbers, the inflammation in your body is a powerful experience. And I had that for myself, and it was just easy to continue that lifestyle because I understood.
I think people find it very empowering when they do go through a program like CHIP or any kind of lifestyle intervention program and see that, boy, they can really make a difference in their numbers without changing medication at all. So I think we embrace any program that encourages lifestyle intervention, increased activity, and healthy eating. So whether you decide you can be a vegan, vegetarian, or just try to eat healthier, I think all of those are very acceptable options, and do what you can as much as you can. because it does make a difference. And we often use the plate method for instructing people who have diabetes on healthy eating. And the plate method is used also by the USDA in just healthy eating in general. And as you'll see, half of the plate is full of vegetables. And there is a small room for some protein, whether it be animal-based or plant-based. It can be either. But the plate method is a beautiful and simple way to think about eating healthy. And it does give you flexibility in whether you want to eat meat as that 25% of your plate or whether you want it to be plant-based. So it's a great starting point for someone who's starting that process. And lifestyle change is a process, isn't it? It's not a all or nothing. It's something that you move towards and you keep moving, and you should really appreciate any kind of steps that you can make.
Yeah, so we should appreciate the step-by-step process and not condemn ourselves when we make mistakes, but to keep on going and going. Now, one of the reasons I wanted to ask the question, if any of you were vegetarians, I wanted to know, are you in the group of do as I say, not as I do? Or are you saying, you know, I have benefited personally from this, and that you can be an example for someone? So thank you for answering those questions.
And I just want to say something about being an example, too. Just because that was my experience, it certainly isn't the only way to go and the only experience to really gain control or have those life-changing experiences. People do it in all different ways. But I think really understanding and learning how it works for you is a good exploration to kind of embark upon.
I wanted to say that in terms of making healthy lifestyle changes, you know, a good place to start is just adding some more fruits and vegetables. And I found this reference from, it relates to how we as Americans are doing compared to what the dietary guidelines say we should be doing. And up on the top half of this paper, it says that maybe, 60% of us are getting enough vegetables, and maybe 40% of us are getting enough fruits. So you can clearly see that we're falling behind the national guidelines in fruits and vegetables and whole foods. And so I think just a simple step is to, you know, there used to be a slogan, eat 5 a day. And I think that's a simple thing that would help with weight management. It would help with maybe, you know, better bowel movement habits, you know, prevent constipation. It would help just with a lot of different things, maybe prevent certain types of cancer. So it's a way to start the whole process.
And I think it's way more important to put those things in your diet than focusing on taking things out of your diet.
Right.
Perception really has a lot to do with it. Like I said, I didn't want to call myself a vegetarian because I didn't want to feel deprived. But if I looked at it as, if I'm doing something that's good for my body, that's a very positive thing. And I think that is something Athens County could benefit from. Instead of feeling like you're going to take this away from me, what can we do to help?
And we also, as far as educators, want you to know what there's a whole bunch of foods that I may have not tried when I was a meat eater. And so when you say deprived, that's kind of maybe where you're at in life now, but actually there's so many more foods that I've been shown and know how to fix now that I've experimented with other foods, that we want to show people that there's so many more foods out there than what you even knew of existed before. So hopefully that nobody will feel deprived. There's an abundance of wonderful food and flavors to work with out there.
And I think the other great thing about Athens County is the local food, right? So if you are a meat eater, you have the best opportunities for the healthiest kinds of meat. You have local, fresh fruits and vegetables. So that's a real plus as well.
And something that we've seen in our programs, I know at Live Healthy Appalachia, people come to us and they want to better understand the link between health and food and how they can make those changes, but they don't necessarily know where to start. So, you know, some of our programming, we've started doing grocery store tours. You know, sometimes you can go to the physician many, many times, but maybe what you need to do is go to the grocery store with someone who can help you figure out not just what to eat and how to eat it more healthfully, but how to eat it on a budget, you know, how
Right.
to make choices that are both good for your body. We hear very often this myth that healthier food is going to be more expensive, but truly, you know, in our experience, and it's been studied, it's really an incredible array of plant-based and healthier options out there that are really economical. And so we do grocery store tours, and in 2015 we'll be doing healthy cooking classes here in Athens and in some of the villages outside of Athens City, trying to help people orient to some of the skills, and you know, just appreciating food if you don't know how to cook it is very difficult. So making it more fun, bringing some of the energy back into taking good care of yourself, and I think that that's something that Athens, we're really trying to make those resources available to people.
In our DPP classes, we
What does DPP
the
stand
diabetes prevention program classes, we will try recipes, bring them in, do taste testing, and so everybody every week gets a recipe to take home and try. And what Barb was saying is very true. A lot of times people haven't tried so many different foods that are out there. And maybe they're afraid to. And when we go to the grocery store, we're in such a hurry. There's so many foods we've never even made eye contact with. So when we start trying these different foods and you realize they are available locally, it gives them, you know, at least a chance to try something different instead of thinking, I can't have this anymore or this anymore. Look at all the things I can try. And we try them in the classes so that it becomes a little more doable.
Okay. Now, it used to be said, and I want to ask, is it still true or not, that when you go shopping, you should only shop the outer perimeter of the store. Anybody want to comment on that?
It's a good rule of thumb to start with, yeah.
Can you explain why?
Well, all of the fruits and vegetables are in the perimeter, and the frozen fruits and vegetables are generally in the perimeter as well. And all the processed food and sugar-sweetened beverages are in the center of the store. So that's a good rule of thumb, really, to start with.
I tell people when they're thinking about making changes toward a healthier diet and they don't know where to start, the number one thing you can do is just cut out processed food, drink water instead of soda, just reduce things that have been taken out of their natural state, taken away from a plant-based whole food, and processed into something that's got a lot of added sodium or sugar, and that's all. Very often, all those products are in the middle of the store.
So processed food could be considered a villain.
That would be my opinion, for sure.
Well, often processed foods are high in sugar, salt, and maybe high in fat too. So one little visual I like to give people is imagine this snack food that you eat in your hand. Now, if you took away all the sugar, all the fat, and all the salt, do you know exactly what would still be in your hand? And if you can't really imagine, it may not be a very healthy food. It may not be a food at all, but a food-like substance, right?
Right.
That's a great concept to impart on people.
You know, and it reminds me too, Karen, of this website, and Randy, you might know about it. It's what people eat in a week around the world, and they show pictures of families and all the food that they consume in a week. And when you get to this American culture, you really don't know what those foods are based on the packaging that they're in. You know that it's a processed food by name and brand, but you really don't know what exactly is in it. But other cultures around the world, you see exactly what they're eating, those grains, those fruits, those vegetables. It's very different.
Very, very different.
To lead into talking more about the diabetes, and Barb has some wonderful visuals that we want her to show in a minute, but packaging and learning to read the ingredients is so important. I have a friend that years ago was having trouble with diabetes, and they couldn't figure out why, because they were being very careful with what was eaten. The problem was one of the ingredients was sorbitol, and I believe we need honesty in labeling, and to say something is no sugar added, but to have sorbitol in it, I think is a lie, because sorbitol is a sugar alcohol. An alcohol sugar. Correct?
Sugar, alcohol, right.
Yeah. So we pay attention to that. If you're concerned about sugar and processed foods, don't get anything with sorbitol. he had a horrendous problem as a result of the foods that had sorbitol. Anybody want to add further about that?
Well, the labeling, the way they can get around that is if it has less than a certain amount of sugar in it, they can say it's sugar-free. But sugar alcohols do have some sugar in them. So often the label refers to a serving size that is much smaller than what we would typically eat. So they can say it's sugar-free, but if you're eating 3 or 4 or 5 servings, it indeed does have some sugar in it because the sugar alcohol does have some. We teach labeling in our diabetes classes. We have free diabetes self-management classes every month, the first 3 Thursdays of every month. A grant, the Ohio Heritage Foundation grant, pays for the classes. So anybody that's diagnosed with diabetes is eligible to come to these free classes. And you can call my number, 566-4877 or 566-4880 and get on the schedule for our free classes every month.
And where are those classes held?
Right now we're actually holding them at the market on State Street in Athens, Ohio, in a vacant store down by the play area. And because it's easy to park there and easy access for people. So, but we will talk about labeling in those classes, healthy eating, and carb counting and things like that. That would be very informative for people with diabetes.
Okay.
Can I say something too? We've talked about a lot of different access to health education, and I just wanted to put a plug in for one more thing that as dietitians, Karen and I do. We in our offices do see people one-on-one, and so if your physician refers you, the medical term is medical nutrition therapy. That's what dietitians do. So we see people in our office one-on-one with a referral from a physician, and I can share. Most physicians know, our fax numbers and know how to send those referrals. But, or if you are a person in the community who wants to see a dietitian one-on-one, and you need help getting a referral, you can call me or call Karen. So, and that's very typical around the country in the United States to have some dietitians at either in private practice or in a healthcare setting. But it is we do see people, and we do bill insurance, and so that's another access point to see a dietitian.
Okay. Now, we've touched on diabetes and other things. Is there anything that we haven't touched on in that particular area that you would like to address, or your particular program?
Well, something that's very, very important for anyone who's gone through programs and learned a lot is can they sustain the changes that they've learned? And the problem is a lot of people, after the program's done, start to slide. So support is really, really an important factor in any kind of lifestyle change program or diabetes education. So we do have adult diabetes support group, and our diabetes prevention program classes will start in January, a diabetes prevention support group also. So the diabetes support group is every month on Tuesday, the first Tuesday of the month at the Athens Community Center. The support group is really, really, really helpful for people with diabetes and for people who have gone through a weight loss program like CHIP or DPP, just to have people that have gone through the like program to share with, get support from, and continue learning. And that is the real crux of the what makes a person successful at change is to continue to learn and continue to have support in the community. And I think Athens, for such a small community, has a lot of support in it, systems.
That's good.
Yeah.
But it's learning where it is and how to access it.
Right.
And that's what
Right.
I really, really want to do today, is to make sure everybody has access to your contact information, because hopefully people will be motivated and encouraged that then they'll contact you.
And if they want information on one of the other programs, then we'll be glad to share that, whoever they call. We embrace all programs. I often have people in DPP that have gone through CHIP, and I have people that have gone through DPP that plan to go to CHIP. So they're really just wanting to learn and do the best they can for themselves, and all the programs are great for that in the area.
And I just want to invite people who are watching, if maybe 6 months from now, they forget everybody's name and everybody's contact information, we have a great resource in 211. And all of these resources are connected to that resource number. So people can just dial 211 here in Athens County and just ask for diabetes prevention programs or lifestyle change programs, and they will have all the information that you just heard about.
So just dialing 211 will access information about all of your programs?
You could have saved yourself a whole show by just
But it's more fun having real people.
I also wanted to mention that Ohio University has really, their mission is to do a lot for diabetes education and prevention. And we have the Diabetes Institute at Ohio University now. They have a website, and their mission is really to, reduce the incidence of diabetes and offer care to people with diabetes in Southeast Ohio and surrounding areas. So that's also a resource, and they can just Google the Diabetes Institute at Athens, Ohio, or Ohio University, and they have a web page that they can go to for different resources also.
And Ohio University also has the risk reduction program for their employees, which is a similar program teaching much of the same information, how to make healthier choices, how to empower yourself with new information about getting healthier, maybe preventing disease as well as reducing your risk. If you're already pre-diabetic, you might avoid diabetes altogether by going through these kinds of programs.
That's right. They even have a dietitian at WellWorks, so you can see a dietitian there too.
That's very good. Barb, you've been sitting there with some visuals on your lap that fit into why diabetes is such a problem. And I would like you to explain some of the things connected with these visuals, please.
Okay. My first visual is this glucose wand, and there's two of them. This is the first one. This represents normal blood sugar. So the liquid would be your blood, and the white crystals would be glucose or nutrients that need to get to your body's cells, to provide nutrition. Or it could be just to provide oxygen and the right amount of nutrients. So if your blood sugar is normal, your organs, like your heart and your kidneys, get the nutrients they need. However, if your blood sugar is too high, this is a representation of how slow and sluggish the glucose and the nutrients flow through your blood. So when people wonder why, this is just a representation of why might I get diabetes complications. If your kidneys and your heart and your other organs aren't getting the nutrients they need, they're not going to operate and function properly. So one of my clients said, Barb, the doctor and you could tell me all day long I need to get my blood sugar down, but when I saw those tubes with the blood flowing through, that really hit home, and it really connected to me that I needed to, do something differently. Well, I'll show this now. We'll talk about obesity in a little bit. As we all know, being overweight increases our risk of medical problems. So we'll look at, there's different definitions of overweight, of normal weight, and normal weight, overweight, and obese. But this represents a pound of fat, 1 pound of fat. And
It's yucky.
when you're obese, and especially if you carry your weight around your middle, the extra fat around your waist, you have higher risk of heart disease and other problems. So this is just, when some people see that 1 pound on the scale, and the old scales are just a notch, right? There's just a little, and they think when I lose a pound, that's nothing, people who come to me. But really, look, when you lose a pound, if it's a pound of fat, you're doing a good thing. So celebrate I had a client today who maybe lost a half a pound a week. And even though she and her doctor wanted to lose faster than that, I said, well, a half a pound is still better than nothing. And in public health, health, we know that if we could all maintain the weight we graduate from high school in, we would have much less disease. So also we'll talk about that later, but we talked about diabetes and we didn't talk a lot about what is diabetes, but I know we wanted to talk a little bit about insulin resistance. And the way you can explain it, or at least the way Dr. Neil Barnard explains it in his book that we'll show you here in a minute, he talks about inside of our cells we can accumulate fat. And so he represents doing a low-fat, high-fiber, low glycemic index meal plan. So a vegan, low-fat, high-fiber, low glycemic index meal plan. And he talks about we can reduce the fat inside our cells and then reduce our insulin resistance. The way I remember what is insulin resistance, to the public here, that's a confusing long term. Your cells are resistant for the insulin to get in there to regulate your blood sugar. And they're resistant because of either abdominal obesity in general, or because the insides of your cells have too much fat. And so fat is just a big factor in a lot of medical conditions, and having too much fat in our body can increase our risk of certain types of cancer, and so it's just phenomenal to me and how important it is to just maintain a good body weight for our height. And many people are referred to me with the diagnosis of obesity. So I like to help people to reduce their weight and be their cheerleader, because not everybody, but most people know some of what they need to do to lose the weight. They just need a coach or someone to help move them in the right direction. So so when you do lose weight too, I encourage people, if you've lost 10 pounds, to pick up a 10-pound bag of dog food and just see how that feels, walking through your kitchen with that. And so anyway.
For health benefits too, you don't necessarily have to go back to the weight you were when you were 18. Just losing 5 to 10% makes a lot of difference, and improvements in blood pressure, blood cholesterol, blood sugar if you have diabetes. But I'll often use a 5-pound blob of fat at health fairs and explain that that's the problem with type 2 diabetes. It's not sugar. It's fat accumulation in and around cells and in the liver. And if you can lose some of that, that reduces your insulin resistance a lot. So that's the problem with type 2 diabetes. And sugar, high blood sugar, is a symptom of the problem. But the problem actually is fat accumulation over the years. And how do you get rid of that? By paying attention to what you're eating, learning as much as you can, being physically active as you can, and learn what you can do to improve your diet and increase your physical activity. It's a personal journey, for sure.
And if you do it the right way, if you do it healthfully, if you do it by changing your exercise and diet habits, you'll probably notice that, the number one thing we hear about in CHIP, and this probably is the case for you, people have higher level of energy, they sleep better. Folks who suffer from depression very often see those symptoms reduce. There's just a lot of things that you might not associate with physical health problems that are actually totally curable and really in your own hands if you can make some changes on your own. And I'm sure you have the same experience for your folks that go through the diabetes prevention program.
Yes. If things like, I always had stomach problems before, and I noticed I don't have that anymore. It's amazing that just the things that I hear them say. A grandparent will say, I never thought I'd be able to walk up a hill again. And at the end of the 1 year, she's not only able to walk up, but she's able to walk up 2 or 3 times. And I think people think as they get older, their health is going to naturally decline. There's a lot of things they can't do. But indeed, a lot of what they can't do can be improved by lifestyle improvements that are very doable.
And I'm thinking about some obese people right now that really, I'm so proud of them that they start out with, I've seen people weigh 400 pounds and they started out walking within their apartment or their trailer, and then they got to start to walking outside, and just people that have, even with some back pain, have been able to, I saw somebody the other day that said, I started out slow, but I walked to the end of the driveway, and then I walked a little further, and then he said in the end he was walking several miles in a day. And so there's just so many stories we could share that are just inspiring for people when they get ready. They have to be ready to make the change, but once they're ready, we really see them make the changes and improve their health. Heartburn, I mean, somebody was upset they didn't maybe lose as many pounds on the scale, but you know, they said they have reduced heartburn, and so that was enough motivation to keep them going.
So it doesn't need to be monumental changes all at once. It can be baby steps, and small steps can add up and make a very big difference.
Start carrying a water bottle, start walking, get a pedometer. It will help you be accountable to your own, you know, simple things, just getting a few more steps in, parking further away from the store entrance. Very small things. You might not feel like you are making an enormous effort, but slowly, if you do those things over time, you'll start to see the payoff, and that's a really positive thing.
I was thinking we started talking about obesity, but we didn't really talk about what is obesity. If your body mass index, which is a relationship of your weight compared to your height, if your body mass index is 30 or greater, you are obese, and it's just a medical term. I tell people we're not trying to call you names. It's just a medical term that puts you at increased risk for diabetes and heart disease and medical problems. If your body mass index is 40 or greater, that's called morbid obesity. And you know, I do try to see people in the hospital who have morbid obesity because I just want to touch base with them to see if they need any help. And we have at least 3 people every day, at least 3 on my list of people I visit that have morbid obesity. And that's, you know, really, as you know, it has been increasing. I think we're starting to stabilize a little bit. I know in Athens County, at least 33% of people are obese, and there's some healthy 2010 goals to reduce that to 30%. Do you agree? I mean, in the things that you're reading, I think we're starting to stabilize with our incidence of obesity, and it's, a little bit. I thought I read that it wasn't increasing quite as much.
Not as fast.
As it had been, but
I think there's an age group specifically, and I don't know, Patricia, if you've seen the Centers for Disease Control and Prevention maps that kind of show the spread of overweight over the years. But there is one age group that's actually reducing or declining in their incidence, and that's 3 to 5-year-olds. And they think that that is related to the changes in what is given for WIC, so related to the WIC requirements. And so it's interesting. And when we talk about, again, this population-based or broad-based approach to infrastructure change, that's a policy and system change that impacts health. And so that's we just need to have adult maybe requirements like that, and we'll see a change.
Well, with adults, I think it's more grassroots efforts. So education from health departments and from health professionals, helping people to understand what they need to do, and then they demand from their food supply, restaurants, grocery stores, that we get kale in, that we have such and such on the menu, that we, reduce portion sizes. And with adult changes, I think education and then grassroots movements are very, very helpful too, rather than top-down always.
Absolutely.
And unfortunately, top-down a lot of times doesn't work because there's so much pushback from very powerful industry. And food industry in this country, is very, very powerful.
Yeah.
Compared maybe to other nations where it's not marketed so heavily and packaged and things like that.
I think that is exactly right. I think providing experiences. I know in Athens County, you can get a grocery store tour. You can, if you belong to a food pantry, Community Food Initiatives actually does cooking classes in the food pantry. So given that experience and that excitement for food, that's what's going to excite people. And making sure that when those folks who are at the greatest risk of health concerns have the best opportunities possible. So people using food pantries, making sure, and again, Athens County is doing a pretty good job at this as well, making sure that that healthy food base is there for them to access.
Can you talk about the donation station on Community Food Initiatives work? Because I think that the idea of local food access, healthy food for everyone, that's a really powerful thing that's happened here.
Right, so Community Food Initiatives does sponsor a donation station. You can go to the Athens Farmers Market, the Chester Hill Produce Auction, and make either a food donation or a monetary donation, and any money that's donated is actually spent at the market. And that food, all of that food, is donated then to local food pantries.
That's great.
And I think to the tune of more than 65,000 pounds this year.
Wow.
That's tremendous.
So it is a strong and important system, again, because people in Athens County care about that. And so, so it's not just one organization trying to make sure there's access. That wouldn't work. So because so many people care about providing that access, it works.
And, you know, in the sense, I mean, Athens County and southeastern Ohio and the region of Appalachia have some enormous health hurdles. But here in Athens, you know, I think that we've got some really wonderful examples of things that have worked and are working. You know, community food initiatives, the health department here, Ohio Health, and the hospitals here, Live Healthy Appalachia, all have really collaborated on a lot of programs together. We've gotten farms involved, making sure that that food is coming from nearby to where people are eating it. You know, access through the donation station is incredibly important. A lot of restaurants here are really supportive of people who are trying to make healthier choices. You know, there's a lot of places you can go now and get a whole wheat pizza crust, or you could go somewhere and get some healthier options. I know Louie and the Village Bakery and Cafe, Avalanche Pizza has made some efforts. A lot of restaurants have either chip-approved options or a healthier option, things that are lower in fat or just a whole grain or plant-based approach to eating. And I think that's really exciting to see both the collaboration and the response from, you know, private community businesses that want to support either by putting their employees through a program like the Diabetes Prevention Program or CHIP, or, you know, just being a restaurant that supports buying local and serving healthier food. We're very lucky in that way.
You know, and I just want to add on to that, you know, in Athens City, we have a lot of resources. So when we get out in the county, some of those resources are harder to find. And yet there's still some interesting things happening. Rural Action, for example, has done some great things with healthy corner stores. So, for example, the CD Handy Mart, which is a beverage store in Chansey, they work with the Chester Hill Produce Auction to offer fresh fruits and vegetables in the store.
Oh, that's great.
That's a great access point. The corner store, the Gloucester corner store, it's on the corner of 78 and 13. They're starting to sell some fresh fruits and vegetables as well. So again, I think the key is, and the way to change a culture is to make sure that wherever you are, making a choice about being active or choosing something healthy or something to eat, that there's one option, at least an option, that you can make that helps you along the way.
And a point I want to make too, we all agree that eating more fruits and vegetables is very, very important. It's both lower in calories and higher in nutrients. It doesn't always have to be fresh. I mean, if you only go to the grocery store once every 2 weeks, go to the frozen section.
Right.
If you have a freezer in your house, fill it up with frozen fruits and vegetables. It can be frozen berries in the wintertime. It can be green beans and broccoli and cauliflower and things like that. Stock that freezer because you can't eat vegetables at home if you don't have vegetables at home. So planning is everything. Plan to make those available in your house and then you'll eat them. I a lot of times will tell people to protect your food environment, just like you wouldn't let some people inside your house. You'll see them outside in public, but you wouldn't maybe feel like it was a good idea to have them in. Think about foods that way too. What foods are going to be safe in your food environment? And try to keep the ones that you think are problematic out of the food environment of your home. Then you're less likely to eat them.
Yeah, that's great. That's really good.
There's an expression that I've heard associated with chips, and I want to express it and then have some more explanation upon it. And that is forks over knives. Every time I hear that expression, I always think of a poker hand, and so I want to say that forks over knives is a winning hand. Who would like to address that? Miranda.
I can say a few words. Well, Forks Over Knives is a movie and now a book and a companion cookbook all around the research based on plant-based eating. And it's something that's, of course, been adopted by CHIP, and CHIP folks are really supportive. Forks Over Knives is a great movie to see. They have it at the Athens Public Library. So if you have friends or relatives that you might want to introduce healthy habits to, it's a really wonderful place to start. And it unpacks some of the reasons why food and health are related, and some of the reasons why we have misinformation. So I think that's, it's a great film, and it really speaks to the idea that you have choices to make, and you make them on your plate, and you make them in your kitchen, and in the grocery store,
And you know, and I think, I mean, at least what it means to me, Forks Over Knives, you can change your outcome if you eat better, and on your fork, you may be able to prevent bypass surgery and prevent the knife of surgery. I mean, I think that's, I don't know if that was intentional, but I think that might be part of why that was named that way. At least that's what it means to me.
I like the comment too in the movie about addressing how, maybe it's in the movie or just Caldwell Esselstyn says it, but people maybe say that this is a difficult thing to do. You know, the challenge of eating a different way. But it's pretty challenging to go through bypass surgery. It's a difficult thing to do. So if you compare the two, maybe.
Sure, yeah, sure.
Well, don't they say if you think eating healthy food is a radical decision, consider what bypass surgery would do to your body and the healing you would have to go through, when much of that, you know, maybe not every health concern can be met with lifestyle changes, but so much can, and it's a really incredible starting point.
Much more affordable. I mean, for the nation as a whole, too, for the healthcare. For the Medicare population, I mean, the healthcare costs in this country are non-sustainable. So eating healthy is a lot less expensive than open heart surgery.
And I heard Dr. Drozak, who is a lifestyle medicine physician in this area, he mentioned that this chip and plant-based lifestyle does work for 95% of the people. To help them reduce their risk of diseases and help them lower their blood pressure or their blood glucose. Maybe we're not sure why there's still 5% out there that that maybe it's not that might need some medicine or need some other intervention. But I think that's amazing, 95%.
Yeah. And the other 5%, it could be that lifestyle plus the medicine.
Right.
Because for some people, as is mentioned in Dr. Neal's book, they're able to stop medicine altogether, which I think is amazing. Because it used to be, if you were told you had to fight diabetes, it was like a death sentence, and you knew there was no way out of it. But I'm very happy that he is saying, no, we can do something about it, and it is plant-based living. We only have a few more minutes. Our time has gone by very quickly, but I want to make sure if there's anything that you really, really want to say during this time, please take that time now. Who would like to start?
Well, I just want to say one thing, and we've heard things about, Karen had mentioned having a plan, protecting your food environment. No matter where you are, if you're talking about your family, maybe your work site, your faith community, having a plan is a good idea. And we talk about having health in all policies. So if you're a school and you do business, how are you doing the business to maintain the health of your employees or the people that you interact with? So that kind of philosophy, that health in all policy philosophies, is a good one for individuals, families, community groups. And so I would challenge people who are watching to consider and maybe assess their own ability to influence health in whatever way they can.
And remember what Ruth said earlier, make the healthy choice the easiest choice.
And remember that you don't have to be perfect, because nobody is, but you can do what you can do. Don't just think about what you can't do.
Yeah, and you don't have to do it alone. I mean, I think we're all here to say, there's so many resources available. if you need something, find someone at the health department, at a hospital near you, a dietitian, someone in a community-based organization that can help familiarize you with what your options are and how to make slow change, but really long-lasting change.
And hopefully this program has encouraged people, oh, I really liked what that person said. I'd like to see about getting in touch with them. So why don't we start with you, Ruth, and just go down the line and go ahead and give any contact information once again. And if you have email address that you didn't mention before and you would, phone numbers, please do.
Okay. Again, I'm Ruth Dudding, and that's like pudding with a D, Dudding. And you can find me at the health department just by calling the front desk, 592-4431. My extension's 225 if you want to go that far. And I'm Dudding, my last name, at health.athens.oh.us.
Again, I'm Barb Nakanishi, and my phone number at Ohio Health Oberlin is 740-566-4876. And my email is barbara.nakanishi@ohiohealth.com.
And you're going to spell that for us. Start with Barbara.
Barbara, B-A-R-B-A-R-A, Nakanishi, Nakanishi, at ohiohealth.com. And if you're on the end of Athens that you need something in Hocking County, just call me at my Oblenis number and I can give you my contact information at Hocking Valley Community Hospital.
My name's Karen Bailey, and my phone number is 740-566-4877, and my email is baileyk@ohio.edu. I'm the dietitian and diabetes educator and the diabetes prevention program coordinator at UMA Diabetes Endocrine Care.
And how do you spell Bailey?
B-A-I-L-E-Y.
Thank you.
And I am Miranda Kreidler, and I work at Live Healthy Appalachia, and you can contact us at 740-856-6100 for information on our adult education programs or the CHIP program. You can also check out all of our programs on our website, which is www.livehealthyappalachia.org, and I am Miranda at livehealthyappalachia.org.
And how do you spell Miranda?
Miranda.
Thank you. Well, I hope you've enjoyed our program, and if you feel like I do, I want to say come back. Let's do another program either with all of you. We didn't even get to question number 2, so we still have a lot of territory to cover, or we can do an individual program, but wouldn't you like to see them come back? You can hear them nodding their heads and saying yes, right? So I do want to thank all of you for coming today, and I am very happy to do this program.
Thank you.
Thank you.